Ladies, it's actually happened. The NHS has been reviewed for its treatment of women with endometriosis. And let me tell you, the report ain't pretty. Trust me, you're going to want to hear what I'm about to share.
It looks like it's back to school for most healthcare professionals. Endometriosis school, that is. A 2024 review into the quality of care afforded to endometriosis patients within the UK is both revealing and a sigh of relief. Nope, it's not all been in your head. You and most other women with endometriosis have been receiving inadequate care throughout. Endometriosis, A Long and Painful Road, is the title given to a review conducted by the NCEPOD, which stands for the National Confidential Enquiry into Patient Outcome and Death. In a nutshell, the NCEPOD's objective is to improve the standards of healthcare. So they've gone ahead and studied the medical pathway and quality of care provided to women with an endometriosis diagnosis, addressing each part of the patient's journey from investigation to treatment and beyond. And yes, you guessed it, there are shortcomings throughout. Firstly, the review acknowledges the need for greater endometriosis awareness amongst the very healthcare professionals who are meant to treat the disease. It makes the key point that symptoms need to be recognized earlier than they currently are, and that referrals to specialists need to be afforded as soon as possible. The review then goes on to address two more imperative factors of endometriosis healthcare: MDT, multidisciplinary team involvement, and the continuity of care. It states that MDTs should involve GPs and nurses, emergency medical physicians, colorectal specialists, urologists, neurologists, pain specialists, sonographers, fertility specialists, mental health professionals, and pelvic physios. Which begs the question, how is this not standard protocol right now when women have been seeing all of these specialists for decades probably, chasing their tail, being sent from one to the other because one knows no better than the other and they don't communicate? Which brings me on to the next point the review makes, advising that both MDT and clinical networks should be set up to agree appropriate treatment plans and afford women with endometriosis better support. Lastly, the review delves into laparoscopy surgery and the need to improve and evolve procedure from informed consent all the way through to discharge. Now again, how this isn't standard procedure already, I'll never know. The review states that a patient should know what their laparoscopy procedure will involve. Is it to diagnose? Is it to stage their endometriosis? Is it to treat them? Or a combination? That way you're managing a patient's expectations. They are more aware of the benefits, limitations, and risks of the procedure they're about to undergo. Next up, we have operation notes. I'm yet to see my operation notes from 2016, and it's common form for surgeons to leave their patients in the dark when it comes to what actually happened in that surgery. Like, I'm laughing, but it's fucking ridiculous. So the review says that healthcare professionals should document the following: the number of laparoscopies an endometriosis patient has undergone, a comprehensive surgical description plus photos, comment on why any endometriosis was left untreated and why, any difficulties experienced during surgery. I mean, it's not rocket science, is it? And the final last point is on laparoscopy follow-up, which most endometriosis patients never seem to experience. The review points out that patients should be discharged with the following in hand: who to contact if they have concerns, a follow-up plan and ongoing management, the option of a patient-initiated follow-up, the types and doses of the medications they are on at discharge, and the consideration of bone health for endometriosis patients on long-term hormonal and pain medication, which are many. Now, if the above is executed, which many of us going into healthcare with these symptoms probably believed was in place already, new pathways can be created within healthcare organizations like the NHS for patients with or suspected to have endometriosis, where we can feel seen, heard, and receive adequate healthcare by informed individuals.